So thank you so much for coming to talk about the health science career field. Can you tell us a little bit about what kind of jobs are available?
Well, yes, there's a lot of different jobs in the healthcare setting. It takes a team when a patient is sick to help them get better. So you have your doctors, your nurses. Nurses are RNs or they can be LPNs. Okay. You have occupational therapy, physical therapy, respiratory therapy. You can also have certified nursing assistants, and you can have nutritionists. There's diabetic educators. Wow, it's varied. There's a lot of opportunity for jobs in the healthcare setting.
What's it like to be in the healthcare career field?
It's fun, it's exciting. You're dealing with sick people, so you have to have a good attitude. You want to be calm and caring and empathetic. Not only do you have like a sick patient, but a lot of times you've got anxious family members as well. So it's fun though. If you enjoy helping people, it's a wonderful place to come because you really do. You help a lot of people. You school nurses help children in the clinical setting. You've got community health nurses, home health nurses. I mean, there's a lot of help out there. So it's rewarding. I like it.
Is the health science field competitive?
It can be. It can be. Like if you wanted to be a physician, then you have to go for like a 4-year undergraduate degree, and it would be pre-med, and then you have to take a MCAT to see if you can get in, and not everybody makes it. Nursing for the registered nurse is kind of competitive as well. Not everyone that applies to a nursing program can get in. So it can be considered competitive, you bet.
How can, if you don't get into a nursing program, how can you go around that?
You could go into the LPN program, and sometimes that's what we recommend for people who don't quite make it. We're like, maybe you would like to try an LPN, and then you can bridge from LPN into RN. As far as like if you don't make it as a doctor, I don't know how many times you could take the MCAT. Pharmacy as well, you know, that's quite competitive as well, being a pharmacist. So I'm not sure how you would back up and regroup for that. But you have to be strong in science, to have a lot of science background. Your courses are primarily scientific as well before you can get into nursing school. So.
Can you tell us what your specific job is and give us a little bit of information about it?
Well, right now I teach nursing at a community college down in Kansas City. I run their simulation lab. And so simulation is a place that we've created it to look like an actual hospital. You have mannequins in beds instead of the patients. These mannequins blink and they breathe. They have heart sounds, lung sounds, bowel sounds. And we create like a patient care scenario, like something you may see in the hospital setting, so that the students can come in and actually work on the mannequins and but not hurt them in case they do something wrong. So they can't kill them. So thank goodness. But so I do simulation right now, and it requires me to have a master's degree. So not every nurse has a master's degree. So
why did you choose the career that you have?
I like helping people.
Why? Because you like helping people. Why nursing rather than being a teacher or anything else?
That's kind of interesting. I don't have any other nurses in my family. I'm the first one. And I guess it was influenced. I joined the Army when I believe I was 20 years old. And they said, we want you to come and be a medic for us. And I was like, oh, that's kind of interesting. Sure. So I did the medic for the Army, and I loved it. And so from there, the Army kind of talked to me about being a nurse. And I said, well, yes, I think I'd like to try that. So that's kind of how I jumped off into nursing. So, and then I just absolutely adored it. I love working with patients and families, and it kind of spoke to me. So, yeah.
Can you tell me a little bit about the day-to-day responsibilities of being a nurse?
Well, yes. When you are a nurse, you report onto a unit, and you'll get a patient care assignment. Okay? Excuse me. And so you get your assignment and you're going to pass medications. You'll assess your patients. You'll do any type of wound care or dressing changes. Anything that might potentially come down the pike. Lots of blood pressures, lots of medications, lots of just helping a patient get better. Lots of judgment. When you're a nurse, there's a lot of little tiny subtle things that can occur. You have to kind of be aware of it. You use a lot of your thinking skills and clinical judgment. You have to do a lot of judgment decisions. So, but that's pretty much day to day. You work 12-hour shifts, usually 3 or 4 days in a row, and you're busy that entire time. You're busy. Depending on if you're working a heart ward, which is a cardiac ward, or maybe a medical surgical ward, you may see pneumonias, you may see surgeries. You stay pretty busy.
What's special about your job?
Simulation is different. In education, it's something that colleges and hospitals are starting to adopt. They're learning that it's a really neat way to teach you so that you have hands-on with a patient that you can't hurt. So say that you have a procedure that requires the students to, or the nurses to maybe react. Maybe you come in with the mannequin and you put it on the floor and you just yell help. So they've got to come up and they've got to very quickly assess that mannequin and maybe begin CPR, or maybe begin rescue breathing, or maybe a seizure is occurring and they've got to protect the patient. So it's a very good tool to teach and to reinforce that, what they've already learned. So that's what makes us kind of unique. You don't really get that opportunity. You know, you either have a live patient or you have this mannequin. So we're a neat way to teach.
What qualifications do you need to go into your career in general, as far as education, training?
All right, so right now, if you wanted to be a registered nurse, you have 2 avenues of entry. One's called an associate degree, and that's what I teach at right now. And you get all of your scientific prerequisites through your community college, and then you come into our nursing program, and our nursing program is 2 years. And so that typically you'd be done in about 3 years with a registered nurse degree. That allows you to sit for your NCLEX boards. That's the licensing body that tests you to make sure you're ready to be a nurse and you're licensed. The other avenue is a Bachelor of Science degree in nursing. That's a 4-year university. It's a 4-year degree. And they would prepare you to sit for the NCLEX as well. So,
what's the difference between the 2 degrees?
Usually length of time is all. So we're 3 years, they're 4 years, and the different types of courses that they might put in to make it that 4th year is like community health nursing. They'll teach them research, or they may teach them nursing theory. We don't teach that in the associate degree. We take you through fundamentals, a couple of different med-surg courses, a beginning med-surg and a senior level med-surg, and then we usually do peds, OB, and mental health. Pharmacology and pathophysiology, and that's it. We give you the basics. Yeah.
So the 4-year degree gives you more qualifications than having a 2-year bachelor degree?
Well, in the grand scheme of things, you both sit for the NCLEX. You
Yes.
both can pass it and be licensed as RNs. But how the RNs are utilized once they graduate can be slightly different. Your graduates that come from a bachelor degree program, they can go on and get a master's degree. Some hospitals only hire nurses who have a bachelor's degree. Let's see, what other differences are they? Some of your bachelor degree nurses that have a BSN will go into a leadership position in the hospital. They'll hold a charge nurse position, or maybe they'll move into a head nurse position. Associate degree, they can have a charge nurse position, but they have to go and get their bachelor's degree in order to typically move into charge nurse positions, or in most hospitals, or get their master's. So there's a little bit more that needs to occur. But they'll practice side by side in a hospital setting. They'll practice side by side, so without any difference.
What does getting this education cost?
At our community college, I want to say that by the time they're done with their 3 years, it's around $15,000. We have right now a articulation agreement with KU with their program where the students come through us and then do some of the bachelor requirements for KU. That particular program right now is at the 20,000, 22,000. Not bad. Oh, I think it's 22,000. A typical 4-year degree, well, K-State, you know, if they had a nursing program, and KU is right there about the same. I think it's around $60,000 for all 4 years. It's quite expensive. Or can be.
Would you suggest that a hopeful future nurse would first go through the associate's degree and then go and get their bachelor's?
It kind of depends on the student. So first off, it's a good deal. Our tuition and our with KU like that, that's a good deal right there. They're going to come out ahead. But an associate degree program is not for everyone. It is 8-week courses, and it is a lot of information within 8 weeks to get. And so you have to be able to learn in that type of environment. A typical bachelor's degree is 16 weeks. So, or university course. And so they have a lot of 16 weeks to kind of absorb and learn and know versus 8 weeks. So you got to kind of know yourself.
Which route did you go through to get your education?
Oh, a bachelor's degree. I did. I know myself inside and out. Don't do well. I like to have a lot to do and have that load, but 8 weeks I think would have been too much for me. Even now when I chose my master's program, I chose a traditional 16-week. Takes a little bit longer, but I didn't mind that. And right now I'm in a postmaster's certification, and I chose a 16-week. So, because I know how I learn and how I like to learn, so it's good to know.
If you could suggest any school for someone who wants to go into nursing, what school would you suggest?
Any school of nursing is okay as long as it is accredited. Do not go to a non-accredited school of nursing. Okay? What does that mean? That means that if you choose to go on, like if you want to go and get your master's, you must be at an accredited school in order to do that. If you didn't go to one that did have accreditation, then you can't go and proceed on for your master's. So make sure that any school you attend is accredited by the higher bodies. For us in Kansas, it's Kansas Board of Regents. For nursing, you have NLN and ASIN that accredit you as well. And then we also have state boards of nursing that look at us. Make sure that's all in place before you choose something.
What should students look for when choosing a college that is best for them?
Affordable. They want to look at NCLEX pass rates. You don't want to go to a school that has low scores. You want to go to one where the NCLEX pass rates are high. Because really in the grand scheme of things, that's what you're going to school for. And you could go to associate degree program or even a university that has a 4-year degree all the way through their nursing program and then not pass your NCLEX. And then you cannot be a nurse. You can't be a registered nurse. You have to pass your NCLEX in order to have that happen. So.
Can you take that NCLEX more than once?
Yes.
Okay.
Yes, you can.
What makes a person successful in this career?
You have to be a fast thinker. Okay, if a patient starts getting into trouble, you don't want to stand around. You need to be able to think and intervene. You're listening. You need to know your sciences. You need to know the pathophysiology of the body, how medications work in the body. There's a lot to pull together. But so you got to be knowledgeable. Got to keep researching. Stay up with your the latest and greatest as far as patient care goes. But most of all, I think you've got to be a good thinker who can sift through data and come to a decision about what's happening and help them. A lot of times patients are like, I don't feel good, something feels wrong. And you've got to be able to take everything that you can see and your blood pressures and maybe lab values, and you've got to help them come to a decision as to what's going on so you can help them.
Do you have any last tips or any other information that you'd like to share with us?
Nursing is a wonderful profession. There's always jobs. The pay is really pretty good. And if you want to be a nurse, come on. That's it.